Imagine the scene where you are sitting in the doctor's office, anxiously waiting for the results of your blood test. Deep inside, you know that something is wrong, but you're hoping that the results are not as bad as you think. The doctor enters the room and breaks the news that you have prediabetes. A sigh of relief. At least it isn't diabetes. But should you be relieved to hear that? Stay tuned till the end of the video as we look at what prediabetes is, its warning signs, and how to cure it. So much to cover, so let's jump right into it. What is prediabetes? Prediabetes is the calm before the storm being type 2 diabetes. It means that your blood sugar levels are high, but not as high as type 2 diabetes. You are on your way to becoming a diabetic, but you're not there yet. If left on its own, it can turn into full-fledged type 2 diabetes before you know it. But why do our blood sugar levels increase? When we eat food, the carbohydrates get converted into glucose, and the glucose gets absorbed into the bloodstream. As you must know, that glucose is the fuel that powers our body. It is required by the cells of our body to produce energy. However, the glucose cannot enter the heavily guarded territories of cells without a key. Insulin is the key that allows the glucose to enter the cells. So, when our blood sugar levels rise after a meal, insulin gets released that facilitates the passage of glucose into the cells. The cells of our bodies use as much glucose as is required, but since we eat a lot, and there is almost always some leftover glucose, this glucose is then stored in the liver as glycogen. And when this store is filled to the brim, then the remaining sugar gets converted into fat. What if something was to go wrong with this insulin action? The blood sugar levels will start to rise. If the pancreas cannot produce insulin, as is the case with type 1 diabetes, then the glucose would start piling up in the blood and cannot be utilized by the body. If the pancreas can produce insulin but not as much as is required by the body, then again the blood sugar levels start to rise. Some people develop an insulin resistance, where the pancreas produces the insulin, but the body doesn't respond to insulin. Both of these situations correspond to type 2 diabetes. But where does prediabetes fit in this picture? Prediabetes is the precursor of type 2 diabetes, which is due to a poor diet. Due to a sugar-rich diet, the demand for insulin is too high, an order the pancreas cannot keep up with, so the blood sugar level starts to rise. It is a fairly common thing in the US, with 1 in 3 US adults being pre-diabetic. Prediabetes is like a train station. You could sit in the train heading towards a normal blood sugar level, or you could continue your journey towards rising blood sugar levels and reach type 2 diabetes. According to American Diabetes Association, 10 to 23% of pre-diabetics continue to digress towards developing type 2 diabetes within 5 years. How to detect prediabetes? Unlike the type 2 diabetes, prediabetes doesn't have clear signs. Due to this, it is often difficult to detect prediabetes without blood tests. The symptoms only start appearing after the prediabetes matures to type 2 diabetes. Some of the symptoms of type 2 diabetes that could also manifest in prediabetes include increased thirst, frequent urination, tiredness, blurry vision, longer healing period after cuts and wounds. If you see any of these symptoms, then your only option is to visit the doctor. There are 3 blood tests for detecting diabetes. Your doctor will probably use one or more of these for diagnosis. Number 1. Fasting plasma glucose or FPG test. For this test, the doctor will ask you to fast for 8 hours before drawing blood. Usually it is done by drawing blood first thing in the morning before eating anything. If the blood sugar level is below 100 milligrams per deciliter, it is considered normal. The blood sugar level between 100 and 125 milligrams per deciliter corresponds to prediabetes. Above 125 is diagnosed diabetes. Number 2. Oral glucose tolerance test or OGTT. This test also requires fasting. However, the blood sugar level is tested twice, once in the fasted state and the second after 2 hours of consuming a sugary drink. If the blood sugar level is below 140 milligrams per deciliter, it is considered normal. The blood sugar level between 140 and 199 milligrams per deciliter corresponds to prediabetes. Above 199 is diagnosed diabetes. Number 3. Haemoglobin A1C test. The H1AC test is not an instantaneous value of blood sugar, like the other 2 tests, but is rather a measure of average blood sugar levels over the last 2 to 3 months. There is also no requirement of fasting for this test. An A1C value between 5.7 and 6.4% is diagnosed as prediabetes. A higher A1C value corresponds to a greater risk of turning into diabetes in future. Who are at a greater risk for prediabetes? Since prediabetes is difficult to detect, some groups of people should be more vigilantly looking out for any signs and symptoms of prediabetes, as research shows that these people are at a higher risk of developing prediabetes. These include people above 45 years of age, overweight people with a BMI of 25 or higher. According to research, people with ethnic backgrounds such as African American, Asian Americans, and Native Americans are also at higher risk. People who don't exercise at least 3 times a week, close relative to type 2 diabetes patients. Is prediabetes reversible? You bet it is, but it will require some effort on your part. Let's look at some steps that you can take to ensure that the prediabetes doesn't turn into the nightmarish type 2 diabetes. Number 1. Change your diet around. If you have been diagnosed with prediabetes, then it goes without saying that you need to change your diet. High-carb foods need to go. There's no way around it. Try to eat fiber-rich foods and avoid processed foods with added sugars. Some of the preferred food choices include veggies, whole grains, lean meats, fruits, legumes, and healthy fats. Similarly, the foods that can increase your likelihood of developing type 2 diabetes include beverages with added sugars, fast food, cakes and candies, refined carbs from foods like French fries, and red meats. Number 2. Exercise, exercise, exercise. According to a report in Diabetes Care, exercise can delay or even prevent diabetes from developing. 30 minutes of walking daily and doing some kind of resistance training twice a week should be enough to revert the crisis. The important thing is to remain consistent rather than going all out and burning yourself out. Number 3. Lose weight. Losing some weight can not only decrease your likelihood of developing type 2 diabetes, it can also keep other serious complications like heart diseases, kidney diseases, and strokes at bay. You don't need to lose a lot of weight to start experiencing changes. Losing 5 to 10% of your weight is enough to reduce the risk of type 2 diabetes. That doesn't sound hard at all, right? If you improve your diet and exercise regularly, losing weight should come naturally. Number 4. Stop smoking. Smoking can cause cancer. Most people know only about this consequence of smoking, but it is a much bigger evil than that. There are other gruesome diseases also frequently associated with smoking, like lung diseases, heart diseases, strokes, and even diabetes. Though less commonly known, smoking leads to type 2 diabetes. In fact, according to FDA, smokers are 30 to 40% more likely to develop type 2 diabetes than non-smokers. According to 2014 Surgeon General's report, smoking can increase the risk of developing type 2 diabetes in several ways. The chemicals in cigarette smoke can interfere with the normal functioning of body cells. That can cause inflammation that interferes with the effectiveness of insulin. Secondly, the chemicals in the smoke can cause oxidative stress by combining with the oxygen in the body. The oxidative stress can cause cell damage. Finally, high levels of nicotine can lessen the effectiveness of insulin. Number 5. Medication. When you're diagnosed with prediabetes, the doctor will likely prescribe you medicines like metformin to lower your blood sugar levels. You may make the mistake of not taking the medication seriously since, you're not diabetic or anything, right? This can worsen the situation and take you closer to the dangerous waters of type 2 diabetes. The tips that we shared with you above, like losing weight, eating healthy foods, and exercising, will surely lower your risk of developing type 2 diabetes, but medication is just as important. Finally, to summarize, prediabetes is the condition where the blood sugar levels are higher than normal, but not as high as in type 2 diabetes. Prediabetes doesn't have clear symptoms, and so it is difficult to detect. The only way to diagnose prediabetes is through blood sugar tests. The people who are at higher risk of prediabetes, or diabetes for that matter, include people older than 45 years, obese people, and close relatives of diabetes patients, to name a few. However, being diagnosed with prediabetes is not the end of the world, and it can be reversed. By following a low-carb and fiber-rich diet, exercising for at least 150 minutes a week, and losing weight, the crisis can be averted. We hope that you benefited from this video. If you did, please hit that like button and share this video with your friends and family. Want to see more videos like this one? Please subscribe to our channel, Welcome to Wellness, and press that bell icon as well so you never miss another video. We'll see you in another healthy video. Until then, take care.